If you're an athlete or a fitness enthusiast or a runner or someone who's just trying to stay active and moving and someone who's dealing with hip pain, this series is going to be for you. Hip pain goes by many names. First off, it all sounds confusing because there's about a million ways to call hip pain hip pain. We can call it hip impingement. We can call it hip arthritis. We can call it IT band syndrome. We can call it gluteal tendinopathy. We can call it greater trochanteric pain syndrome. We can call it a hip flexor strain. We can call it a glute strain. We can call it a hamstring strain. We can call it posterior hip impingement. I'm blanking on a few. Piriformis syndrome. There we go. And many, many other things. So basically, what does that mean? It means something hurts in the hip. Now, why does something hurt in the hip? Well, clinically, that's what we're here to do, and that's also what we're going to be talking about. There are many reasons why the hip joint, and when we say hip joint, we mean where our leg bone, our femur, attaches into our pelvis, what's called our femoral acetabular joint. There's no quiz on that later, I promise. But there's something going on in that region. Now, sometimes sometimes something in that region can hurt because there's something actually going on at the hip itself. And other times there can be something going on with that region because something elsewhere is causing the pain to be there. And a lot of times this will pop up when activities start to change, new activity happens. New activity happens usually too fast, too hard, too strong, too much intensity, too much volume, something like that. This really starts to break stuff down and starts to cause some issues. And what we do in the clinic is we really try to figure out what is causing it, where it's coming from, how do we get it to calm down, and what can you do in the meantime to kind of help yourself along and get this feeling better. What we're going to be discussing here in the next couple weeks is going to be some things you can, simple assessments you can do at home, and then also how we look at and how we treat it here in the clinic. So let's look at the hip joint real quick. So hip joint we talked about is the femur bone attaching into the pelvis, or what we call the femoral acetabular joint. So now this is looking at the bones. Now let's look at all the meat that moves those things. So here we've got all the muscles on top of that bone. So if there's an actual issue at the hip joint itself, any muscle that attaches to that hip joint can be sore, painful, or achy. So if we see all the numbers of muscles that attach to that hip joint, so this is the front, basically the hip joint kind of right through here. Then we've also got the backside right in through here. We have even more muscles. So this is why hip pain goes by so many names. There's lots of different muscles that can be sore, painful, or achy. But basically this means that there's something going on at the hip. We need to look at the hip itself. We also need to look, we see how closely we are at the hip to the low back. We need to make sure that there's not something going on here that's causing issues down and through here. The reason that is we move over. So now this is kind of a rough representation of a lot of the nerves in the body. So we've got the lowest part of the low back kind of down and through here. We see that a lot of those nerves actually run down and innervate or make those muscles work on these sides in front of our hip. So this is the reason if there's a problem going on here, we can feel the effects downstream or anywhere those nerves go. So it's why we need to really make sure that we're fleshing out and making sure the problem is a low back problem or hip problem. And then once we figure that out, treatment is very streamlined and direct from there.